Records to the cloud, is that what it says?
Yep. Can't see them.
Gotta do. All right, we are all set.
Okay. So as most of you know, I'm Jen Lynch and the first thing we should probably do is the slate of office
We
nominations.
can't do it without a quorum.
Oh, okay. So we'll go back to introductions and we can go around. I'm Jan Lynch. I'm maybe the chair.
Sure, there we go. I'm Sheila McHenry, maybe vice chair. We've already got. Nicole Fula, maybe a board member.
The new member.
Elena Zaff, hoping to be a member.
Anna Tamus, also hoping to be a member.
I'm Corinne Palazzo, administrative assistant.
Jackie Wonderlick, continuing to be patient.
Travis Winter, member.
Jessica Connor, board member and mental health subcommittee member.
I'm Lockwood from Catholic Charities in Cortland County. Yes, tonight.
Mary Hutchins, member of the board.
And just in time. Tell everybody who we are.
I'm Randy Braddock, the Thompson County Legislature liaison.
And I am Frank Krupa, the commissioner. I'll do online.
I'm Larry Roberts. I'm a member of the board and the chair of the mental health subcommittee.
Great. And Renee?
Hi, yes, I'm Renee Spear. I'm the executive director for Catholic Charities of Tompkins, Tioga. Thank you for having me today.
Thanks for coming. And Lauren? You're on mute, Lauren.
Yep, sorry, it just like popped up my notification. I'm Lauren Tegnander. I'm the Chief Operating Officer for Upstate Programs at Rehabilitation Support Services.
Great. Thank you, everyone. And the next part is any additions or deletions to the agenda. I believe we'll have like did you want to do that at the end, even though we won't go into it? That sounds good. Okay, so we have just a very short period at the end about renomination of some. Renomination, I guess. Reappointment. And then approval of the minutes. Folks had a chance to read it.
Can't do that without quorum either.
Oh, that's right. I keep forgetting we don't have one.
We need 8.
We can recommend, right?
We have.
Who are you counting?
Jan, Sheila, Mary, Larry.
Yep.
Jessica, Jennifer. Howard, because he's a member.
Travis. Or did you already say?
She said Travis. Yeah, one short.
Randy.
Randy
Counts
doesn't
in a lot
count.
of
As much as we love him, he doesn't count for quorum.
And we are
Count,
still
it's not a
waiting
quorum.
on.
Yes, we've had another staff who, Howard made
I
it.
think Stu's on his way though.
All right.
Okay, so we can come back to those things.
Okay, so we'll skip the approval of the minutes and go on to privilege of the floor. Any questions or comments from the board or guests at this point?
I'll share that HSC is having their forum on Wednesday and it's insights into mental health equity. It's from 10 to noon at the library. It is in person and registration is required, and you can go to HSC website if you'd like to register to attend that. And it's going to be a panel of a mix of people with lived experience and experts.
Great, thank you. Anybody else have anything to add?
I just have a question for Nicole. So what's the theme? Is there a?
Mental health equity.
Okay.
I don't have any board correspondence or announcements. So, and we can't do slate of office nominations at this particular time. So the next thing on the agenda is the Peer Outreach Center update, but is Josephine
We
here?
don't have Josephine.
Huh.
Karan, did she?
She didn't respond, but I text her. I mean, not text her, but I emailed her and I didn't hear back from her.
Okay, I need to hire her. If you'd like, we can move on to our other guest.
Sure.
I can try to get.
Okay,
Josephine.
that makes sense. So we now have the Homeless Outreach Services, the Safe Option Support, SOS, and critical time intervention. And the people who are going to speak about it is Tim Lockwood, who just introduced himself from Portland County, Renee Spear, and Lauren. I didn't see your last name and I can't see it. But Lauren will
Tagnander.
also- Okay, there we go. So you guys can get started. I'm not sure what your order is.
I don't know that we really have an order, but I guess I'll start because we are the lead on that grant. So just a little history, I guess. Back in summer, we started this application. This is an OMH funded program. I don't know if everyone is familiar with this particular grant project, Save Option Support. So it's a 5-year program that OMH is funding to do basically street outreach to homeless, sheltered and unsheltered across Cortland, Tompkins and Tioga counties. So it's a regional grant. And the ultimate goal is to get people into stable and permanent housing. So it's a year-long process that people would go through using this critical time intervention model that has come about. There a lot of people are looking at using that model for these programs. So it's like a 4-phase process to really engage with folks and then transition them into permanent housing. So get them connected to community resources, get them connected to supports that will last beyond what the staff in this program are going to do. That's like there's just a big picture of what this is. So we got awarded, I think it was in October, we heard about the award. And now we're just kind of gearing up. We're waiting for a contract, which I guess I think we're going to be waiting a while because Shenango County also has the same project and they started back in early summer and they still don't have a contract. So, and they've put in a lot of money up front to get things going. And now they're stepping back and saying, we're not going to do a whole lot of work until we start seeing some reimbursement. So it could be a while before we really get to where we want to be. Right now, we're just working on hiring a team lead to help kind of coordinate all the stuff that's going to happen in the future. But we haven't gotten anybody yet that's applied that looks promising at this point. But anyway, that's where we're at. So we took the lead on this application. We partnered with RSS. So we're going to subcontract some of the work out to them, and we're going to kind of split the counties. They'll cover Tioga County, we'll cover Cortland, and we'll kind of share Tompkins County as far as staffing goes. So there's 9 staff associated with the grant. There's the team lead, which will coordinate all of the activities. And then 2 positions are licensed clinicians, 2 care managers, and 2 peer specialists. So RSS will have their own set of staff down in Tioga. We'll have our staff up here. And then the team lead will be based in Cortland, and they'll kind of coordinate the activity for everybody. That's kind of how we have it set up right now. And our goal is to really not interfere with the work that everybody's already doing around homelessness and housing, but fill in the gaps and work with what's already existing and just try to enhance what's there to do this work. There's a lot of wraparound service dollars that are associated with this to help maybe entice folks to participate in the program. So hopefully that will help, get people on board and work through that 4-phase process. Housing, I think, is really going to be the biggest challenge. That's the challenge we have in Portland, is actually finding places for people to live. I'm sure it's the same in Tompkins and probably the same in Tioga. That's just the reality of what we we're dealing with right now. I mean, we have many housing programs in Cortland and we're scrambling to just get an apartment. There's not a lot of new units coming online anytime soon, so we're just trying to be creative. I don't know, Lauren already has this program out in Albany. I can't remember the 3 counties, Lauren, you could talk
Yes.
about.
Yeah, so RSS was awarded this program during the first RFP that had been released earlier this year. I think we found out that we were given the award, I want to say in like April or May. And we're officially up and running there just recently, but we are serving Albany, Schenectady, and Saratoga counties with a 9-person team. So they've enrolled it's only, like I said, I mean, I think we've been working for about a month now. They've enrolled about 14 individuals across the counties. And so far it's been, you know, very successful. The wraparound service dollars that Tim mentioned are very helpful to not only engaging people, but then really just meeting the needs of whatever, you know, people may need. They're very boots on the ground, out on the street, working with individuals. They do have like gear with logos on them so that members of the community kind of get to know them too. We've received referrals from some pretty unique places. One that stands out to me is an individual's car was totaled and they had brought it to the mechanic shop, and somehow I don't know if they couldn't afford to have it fixed or what the case was, but the car was there and the mechanic actually had ended up reaching out to somebody in the community because the individual was living in their car. And so we were able to get connected with that individual and get support. So there's just been some really unique ways of linking with the program now that it's gotten out and running.
Yeah, so if they got their award in May, you can see it takes a while to even get to that point where you're actually ready to go. And we have 9 staff to hire, so it's gonna be a process, but it sounds like it's working. New York City's been doing it for a while, and now they're kind of getting into all the upstate counties. So I'm very happy about it. I think it'll be a very good opportunity for all 3 counties and people that we are all serving. So I'm excited for it. I'm a little nervous trying to pull it all together, but that's what I signed up for. So make it work somehow.
How long do you have the grant for?
It's 5 years, starting January 1st of this year. So we're already into it, but
Is there a target number that you?
they want us to serve 70 people a year across all 3 counties. That's kind of OMH's target for us. I don't know if that's the same for you, Lauren, and in your phase.
Yeah, for some reason 90 is sticking in my head, but it's in that area.
Yeah, they told us 70 on the other call that we just had. So that's their target.
So in terms of the population, is it adults, children,
Adult.
and all adults?
Yeah.
Okay.
Yep.
So anyone over 21,
Not sure about that. I would think if it's 18 or older, we probably would work with them. Yeah.
You had mentioned earlier, you're not going to try to duplicate, or that's my word. You're going to work with what, you know, the city,
Right.
the county's already doing. Can you speak a little bit more about that?
It's hard because I'm not that familiar with Tompkins and Tioga. Renee and Lauren are certainly more than I am, but my goal, or the goal I think of the program, would be to really reach out to all the different organizations that are working on this problem to see what they're already doing, because I don't want to duplicate anything. I want to enhance what's already there. So, I mean, we're looking at non-traditional hours, weekends. You know, we'll have a straight referral, one referral number that somebody could call, and then we could dispatch teams out to wherever the need is. But I have to find out first what is already in place in those counties, and then figure out from there what makes the most sense? How can we partner with what somebody's already doing and make it more useful for what they're already doing? And we're just in the beginning phases of that. I mean, I've talked to Harmony, I've talked to Lori down in Tioga County. It's Lori, right? Yeah, the LG person down there.
Yep.
I've talked to DSS in Tioga County. The OMHS has monthly phone calls set up that include all the DSSs and the LGUs from Tompkins, Tioga, and Cortland County, so they can be part of the discussion and hear, you know, for real time what's happening month to month. So I'm hoping Harmony will jump on those calls and be able to keep you guys informed about what's happening on that level. But really, it's getting out and connecting with all the agencies and really just doing that kind of work to figure out what is going to make the most sense. That's why I want to get a team leader hired, so that it's not on me to do that, because I just don't have the time to put into that level of detail. But that's what the team leader does, coordinate all those activities.
Will there be people actually stationed here in Tompkins County?
I think, Lauren, you're probably gonna have them, I don't know where you're gonna station your particular staff, but
Yep. So we have offices in Tioga, but we're also looking currently for a space in Tompkins County for some of our staff. So, you know, hoping to have them more local if we're able to.
and our staff will be based in Cortland, but they can travel anywhere.
Yeah,
So
anybody can
they'll
travel.
go wherever they
Yeah.
need it. Yeah.
I know in recent legislature discussions, Ms. John brought it up, there are quite a few people doing outreach or companies doing outreach right now in Tompkins County. And there was some concern that it wasn't real clear as to if they weren't overlapping.
Mhm.
And I know the homeless coordinator who was here for a little while was working on that, but then she left. And there's data on that, I think. There, it would be helpful to you, I think.
It probably would be, yeah.
Yes.
Yep, if Harmony can supply me with whatever
I'm
data
sure
or
that was
resources.
understood.
Yeah, and we're actually diving into the outreach worker world too. Our department hasn't traditionally been involved in that. But because of the OTR from the legislature funding the rural outreach workers to combine with the downtown workers, we are in the process of putting an RFP together to bring those two programs together. And part of that will be looking at the broader outreach worker system to figure out where linkages could be made and to try to help facilitate some, I don't know what the right word, clearing up of the kind of who's doing what and what functions. So I think there's a lot of positive things happening right now around this issue, which is exciting. The RFP that's about to go out for the opioid settlement funds that came through the LGU, if you remember, was almost this program. Right, it was centered on the hospital folks, and so part of what we're hoping is that that RFP can amplify some of this work as well, and that perhaps our partners here might be interested in being a part of applying for that RFP when it comes out. So I think all of these pieces coming together is really focused on, we know this is an issue and it really needs to get addressed. To Tim's point, though, I think the challenge that we're going to have is, where do we house folks?
Yes.
Right, I mean, if it's bad in Portland, it's probably magnitudes worse here with our current housing situation. So I think that's gonna continue to be on the forefront as we try to solve this problem.
Yeah, to that point, Tim, you said you were being creative with the housing. Could you,
Like my agency, we're working with a landlord to purchase all of his properties, right? So then we would have access to 20 more units, and then we could start using those for our programming instead of just, it's taking apartments from one area of the community and putting them into another, because then that takes it away from just anybody who would want to rent, and we're turning them like apartments. But those are the kind of things I'm thinking about, like when, so if we get a referral into this program, then I might have a way to put them right into an apartment that we own and operate versus having to go through a landlord, right? So those kinds of things. And, you know, the city of Portland looking at doing some things and having some housing projects built that include some affordable housing so that we can address that situation in addition to just like straight program housing. But those are longer term things that are, you know, for a couple of years out. But we're always looking at grant opportunities that come to do more capital projects or other things that we can do to, you know, just expand our housing footprint in Portland. And I'm not opposed to, you know, if there was someone in Tioga who for whatever reason couldn't find housing in Tioga, then they can be housed up in Portland if that's an option, right? If that makes sense for somebody. I can see people kind of moving throughout the region from this program, if it makes sense for that particular person. I mean, there's a lot of people in Portland who have burned all their bridges with their landlords, right? So maybe in Tioga, or Tompkins, they might have a better opportunity to find housing because they're not known to the kind of the system, right? So I'm open to anything, but those are just some ideas and things that we've done to try to expand our opportunities to get people housed. If it's easier to buy own a place than trying to work with a landlord that doesn't want anything to do with the people that we work with.
Other folks have questions, or was there more that you were going to present, or is that pretty much it?
No, I mean, that's a pretty big overview and it's really just getting started. And, you know, Lauren can testify to how long it's going to take to get us up and running, but I'm glad that we partnered with them because they have some experience and that can help us maybe go forward a little more quickly. But a lot of it's going to come down to OMH and how quickly they can, you know, figure out their funding issues. They awarded us money, but they don't want to give it to us.
Yeah, I think we found out in May and we only finished contracting, I want to say in like October, maybe. It may have even gone into November. So it took such a long time to really get all of that up and running. And OMH is really involved in the process. So there's regular meetings and they're involved every step of the way. They really want to be able to approve any forms, assessments, things like that, the referral system and process. So it adds a little bit of time in there as well.
You had a question, and then Jessica.
Yeah, so I don't know what you were gonna talk about in your report, Frank, but it seems like there's a lot of up in the air stuff about who's doing what in terms of outreach workers, and it seems like it's a really essential service to people who are homeless or at risk for homelessness. So I think I would like to know as soon as possible when we have a clear sense of what's actually going to be happening. So maybe in a couple of months, we'll have a better sense of who's doing what, when, and where. I mean, this is a good resource that's going to be coming to our community, but, you know, it adds to other things for us to know as people who are concerned about people who are homeless.
Yeah, I can give, I guess, a little bit more to the outreach worker programs. I think, and again, this is kind of our first foray as a department into the outreach worker and the outreach worker system. And I hope you know by now that when we get into something, we do want to know more clearly about what's occurring. And so the first step in this process will be to create the RFP that brings the two programs together, the Downtown Outreach Worker Program and the Rural Outreach Worker Program that was an OMH grant for a year that the county has now funded, I believe, for a couple of years, to bring those two programs together. So it's a cohesive county outreach worker program. There's only 4 people in that. Now there are 4 people in that leader. There are a lot of other outreach worker programs, as Larry and Randy were alluding to. And I think as we get into this environment, we're going to expect that our outreach worker team understands the totality of the rest of that
Yeah.
system. Because that's the
Yeah.
only way they're gonna be successful. So Larry, to your point, I can't promise that we're gonna have that answer in a month or two. Because we've got to get the RFP out, we've got to get, somebody interested in doing the work. Hint to our friends in the room, that might be interested in applying for the RFP. To then kind of stand it up and become part of that system so we can better understand it and get it cleared up. I'm not sure what the county's plan is yet, county administration on the vacant homelessness coordinator position. I don't know. The last time I talked with the county administrator in early December, she wasn't sure yet what approach she was going to take. I do meet with her again tomorrow, so I might
Great.
get more then on that particular position, which I think will be helpful to this conversation as well.
Yeah.
We are also expanding the care team into the city of Ithaca. We've identified a social worker to join IPD, not to join IPD, but to link up with IPD and form a team in the city, which is going to be a big help too. So there's another place where we're going to have some involvement in connections to all of these systems. That'll be an information place. So we'll be able to quicker about what's going on. So our hope is that by getting involved, we know clearly what this board wants. We know what the legislature has asked for, that we'll be able to be a mechanism or a tool to kind of help bring some of that information together as we move forward. Because there's a lot of programs out there, as folks know. Many of them are nonprofit based, right? So they're not within the control of the county. Many of them are funded by the county, but it's not a direct department to go to and talk to. So work to be done, but I hear you loud and clear, and it is a goal of ours as we move into this part of the county's processes.
Yeah, and I just want to make sure that we all understand how it works, even if it takes a minute to make that clear. And that we have the maximum number of outreach workers that we need so that we're interacting with people who need help.
I think what we do know is that many of the outreach workers have a particular niche or skill set or issue that they're targeted at. And so part of what we've got to figure out is how do we get people connected to the right places, right? Because I think that's one of the challenges and where some of the duplication occurs. I don't think any single outreach worker is going to be able to be an expert in all of the areas that we currently have outreach workers working. But certainly they can know who the right people are and get them connected appropriately based on what they need.
Cool. Thanks, Frank.
Yes, one question is, my understanding with OMH contracts is even if, so say you were awarded it in May and then didn't get the contracting signed until November, is that the reimbursement still backdate to the start of the contracting? Is that right? So with this RFP, any money spent starting 1/1/24 can still be reimbursed through OMH?
Yeah, and we actually asked for that in writing so that we had confirmation because so many of the contracts were getting backlogged for us with some of our other projects, and they had no problem giving that to us in writing.
Yeah, I talked to the OMH person who's in charge of contracting and she seemed in over her head right now. My other question was, so this is for adults, will adults with minor children be considered, or is it exclusively for single adults?
That's a question I would have to ask.
Okay.
I don't know why we wouldn't serve someone who has a child with them that is homeless. I'm not sure why we would exclude them, but I can ask.
Okay.
To see if that's an option, but yeah, I would say if there's an adult, then if not, we would refer them somewhere else that would be able to. If there is anything else.
Yeah. Thank you.
But yes, I will ask.
Travis?
Frank, with the expansion of the care team into the city, will that ease some of the mobile crisis team demand?
Yeah, so Sorry, I'm all over the place
That's okay,
today with
I'm
all
just
these
trying to
things. but-
sort that out in my head. It's-
Yeah.
I'm trying to do a Venn diagram. of-
Yeah, so when the second care team is operational, we'll be standing down our daytime mobile crisis team with our clinic staff.
Yeah.
Which has been a huge overwhelming thing for them to manage that on top of seeing clients and everything else they need to do. We will still be managing whenever the care team is not available. So.
Nights and weekends.
Yeah, so but that's more of an on-call and there's fewer calls that way and it's disrupting your sleep and perhaps your family life, but it's not disrupting your work life and it's
Takes those calls.
so I don't know if it's a good thing or not. I mean, at least you don't have to do both. You won't have to do both now. But,
Fair enough.
and I think folks feel comfortable being able to do the on-call if they're not dealing with the stress of it during the day.
Sure. Sure, that should ease a whole.
Yeah, I mean, ultimately, our hope would be is that we would have care team available, if not 24/7. During the bulk of the hours when calls might be needed, maybe a first and second shift and maybe not.
And right now it's one person
Right now, we have one
in the
team.
county and one gonna be in
Yeah.
the city.
Yeah.
Okay.
The city program's probably gonna be a little different in that they can't assign an officer to the individual. So it's likely gonna be a rotating of people based on the shift and availability. We're trying to be as flexible with them as we can because we really want this operational. They really want it operational. And as we all know, IPD is going through a lot of change and they've got a new chief now, which is great. Hopefully they'll be, their ranks will start to grow a bit as well. And we might get to a place where they would be able to assign someone. But they are very interested and definitely want to make this work. So Harmony's been working very closely with the former acting chief and their team there. And we're looking forward to working with the new chief and getting that operational.
Any additional questions? Okay, I guess we're set unless you had any additional.
No, I mean, whenever you want me to come back and update you or however you want to get information, just let me know and can provide it.
Great. Thanks so much for all three of you coming. Good luck.
Yeah, good luck.
Problem's not
Um,
getting small.
No, it's only grown.
Did you hear?
Yeah, so what Catholic Charities is doing though is it's a little different though than what Catholic Charities of Cortland and RSS will be doing. So I just wanted to, I didn't know if you thought that this was all the same thing between all of us, but we would be actually, we did an RFP also in the summer. But we will actually help with getting individuals into housing and provide the case management. We need to work very closely though with the SOS team through RSS and Catholic Charities of Cortland. So the RFP that we submitted and have been approved does cover 25 units throughout Tompkins, Tioga, and Cortland. So it basically will be 11 units in Tompkins and 7 in the other 2 counties. So in Tompkins County, in all 3 counties, we can help with either a studio or a one bedroom apartment. So it is for adults. And we can help cover the rent. The idea is that individuals will be able to come up with at least 30% of their rent, and then we can help provide the rest of it for the time period that they need, as while we're doing the case management and working very, very closely with the SOS team as well as the ACT team, the Assertive Community Treatment Team, which is, according to Harmony, is out of Elmira Psych Center that covers Tompkins and Tioga, and I believe Cortland doesn't have that team. So basically, we're kind of on hold too with a contract And I'm assuming that maybe they would come out at the same time because a lot of our referrals will come from the SOS. So it'll come from RSS and Cortland Catholic Charities, as well as the ACT team. Now, what I don't know is, can we get referrals from other sources outside of those two? But it was very specific in the RFP that the referrals come from the ACT team and the SOS. So we will be working extremely close with these teams of people to help individuals get into housing, stay stable in the housing, and get the supports that they need, which could be any supports. We can either help, Catholic Charities can either help them with those supports such as employment. So we have Access VR contracts, so we can help somebody get into Access VR. Or if they need different supports that we don't provide, we can find them those resources and connect them to those resources to help make sure that individuals are getting what they need and being stable in a place of their own. So we can basically also help with other things, such as if they can't afford the 30% on their own, there is an additional amount of funding that we can ask for to help cover that 30% until somebody can start getting into a job or maybe get on Section A or whatever to start covering some of their own portion. We can also help with things like if they need certain furniture to get into an apartment. Maybe they need a bed or a dresser or whatever. This grant has a certain amount of funding that we're allowed to use to help support some of those needs. So at this time, we are looking to hire, there's in the grant, there would be a full-time staff person that would be hired for each of the counties. It would be a caseworker that would work with the individuals in each county. So it'd be 3 people that would be hired, 1 for Tompkins, 1 for Tioga, and 1 for Cortland. At this time, Tim and I have talked, and Catholic Charities in Tompkins and Tioga, Catholic Charities has been in these 2 counties for over 25 years. And I've been the exec for almost 12 of those 25 years. So we're pretty familiar with a lot of the landlords, the other housing programs. We attend all the homeless and housing meetings in those 2 counties. So we're pretty well versed, and I think that we could be a good resource to Catholic Charities of Cortland and to RSS and that to, coordinate things. But Tim and I have been talking, and if it's allowed, we will subcontract the housing units to Catholic Charities of Cortland, and they'll take care of the 7 units in Cortland, and then we'll take care of the Tompkins and Tioga units. So that's our plan to go forward right now. With hearing just recently about how long it can take to get a final contract does make me a little nervous, because we are looking to hire staff soon. I think we could cover the cost for a few months and be reimbursed, but probably not more than 4 or 5 months. But I would like to get staff on board and get some trainings and everything done before we're actually starting to work with individuals. Work a lot on procedures and working a lot with when Tim and Lauren gets the SOS team up and going and we all get connected and work well together. I want it to be a very cohesive team so that we could do the best service possible for any of the individuals we're working with. So some of those 25 units can count towards, I believe, the 70 units or whatever you guys have to fill for your quota. So we can help support 25 of those units. So this is very exciting. We have already been in contact with, we're very familiar with the local DSS. I'm very familiar with, Harmony and Lori and them in Tioga. I'm not as familiar with everybody in Cortland, but Tim is. So that's where that would make a great connection. We're in Tompkins and Tioga. Catholic Charities is very familiar with many of the landlords. So that is very helpful for us to have those kind of connections and help people to get into a place. And as people have already said, yes, housing is very difficult in both of the areas. And obviously it sounds like Cortland as well. But we have been able to make some good connections with some other housing programs that we already have, especially in Tioga. We do have a HUD program in Tioga, and we've been able to be very successful in getting people into housing and keeping them into housing. And we have 3 transitional housing programs too. So it does help with having staff right in those counties that know the counties and they know the services. And I think that's where we can be an asset to help RSS and Catholic Charities of Cortland. Questions?
I know you said you have connections with landlords, but is there actually housing out there? It just seems like
Well,
it's such a. Go
You know,
ahead.
surprising enough, we have been able to find housing. A lot of times what happens, especially in Tompkins County, what happens is that transportation is always an issue. And even though there's some transportation in Tompkins, it makes it so some individuals feel a little bit more nervous not to be like right in the Ithaca area, because if they're right kind of in Ithaca, then they can walk to places. If they're on the outskirts, like Newfield or Groton and that, then they get a little bit more nervous about transportation. But we have been able to support people by figuring out the transportation and getting them into housing on the outskirts of Ithaca. And that's been a little bit more successful.
Thanks. Other questions?
Renee, when you said you helped them with transportation, could you explain that more in more detail?
Well, the transportation system is very workable. They have their certain schedules and they have their routines, but they are pretty good if you call them and you work them out and you let them know that somebody really needs this, you know, they need you to come to this route, or they need this certain times. They're pretty good at working that out. We've also made connections through the local churches to help get people rides. And it's unbelievable the kindness of people that will help support and pick up and drop off individuals and give them rides to places. And we've been very successful working through the churches that way.
Thank you.
Other questions? Comments?
No, I just think it speaks to Larry's point. There's a lot of overlap. A lot of
Yeah.
coordination is going to be really
Yeah.
critical.
As you were talking, just like I was thinking, like, we just need a map to visualize all this, the connections and, you know, who's responsible for what. But I guess that's that's why you need this team leader and.
For that program, yeah, but when you talk about all these
Right,
other
but the
teams like
outreach.
that, we don't even have any connections with. It's getting in with them to really map out the bigger picture. Cause I know what we're gonna do, or, you know, we know what we'll do with the SOS team, but that doesn't necessarily mean that's what your other teams are working on. So we do have to kind of all get together at some point and say, here's what we're doing. How can we enhance?
Yeah.
Or pass people off?
But in Tompkins, there's a very good group that meets often, the Housing Task Force and that, and I can easily get you connected there because that's a really good group that talks about a lot of the housing needs and what is already available and what we still need and where the gaps are. It's a really good group. And then there's a leadership group that meets in Tioga, and that's a really good group too, that talks about a lot of the issues.
Okay, if you want to get me connected to them, that'd be great, Renee.
Yep.
Nicole, I'm assuming your housing people are aware and
Well, I was gonna ask if you've been in contact with the continuum of care, Liddy Barger.
No, I
Right.
mean, we're in a different
Yeah,
COC.
so that's who Renee is
But
referring.
Renee.
That
yeah,
is, yes, and I can
But
get you connected to them because we attend all those meetings and everything, and they're good meetings, and it's a good person to get connected with.
Oh, and just to jump into, RSS is working on another housing project in Tompkins County, and we have been connected with Lydia as well. So I've had some brief conversations with her just around this team and things like that too. So she's aware, but I think it would be good to have a fuller discussion with them.
It's an odd question. Was it warmer longer? Do we know? Have the numbers been higher?
Homeless?
Yeah,
That's,
I'm curious.
They do their pit count, I believe, this.
Yeah, it's coming
Yeah,
up.
Yeah.
That's what
I think I heard from, don't quote me on this because I may be wrong. I want to say it was in the 100 plus, 120 folks that they were housing, and this was a few weeks ago. Which I think was a little lower
Okay.
than last year, but they were expecting more as the weather got colder because it hadn't been as cold. Don't quote me on those numbers. I'm sure I'm but I think that was the last update. But they do their count relatively soon, so we'll know that number in particular. But it is also a time in a once in time count. I think the numbers that BSS is housing, is a more dynamic number because, they're updating that regularly.
Just have a question, with the encampment in Ithaca, are you targeting those folks in these?
I mean, we can, if that's where the deed is. I mean, what OMH was saying on the last call is you focus where, if you're seeing less need in Cortland or in Tioga, then focus your efforts on Tompkins or wherever that need happens to pop up. That's where you want to go. There's no like Portland has to see 50 people and Tompkins has to see 50. It's like it's a combined number. So they want you to go wherever the need is the greatest. So I can't remember who was on the, was it Kit? Somebody was talking about the encampment. I can't remember who it was. And, and the efforts that this might be a good place to have some help in that area. And so, yes, we'll talk more about that as we go forward. But I think OMH's vision is you go where you need to go, and you're not limited by the county, and there's not a quota here or a quota there. It's wherever you got to go, you got to go. And so putting that together it's going to be the trick.
I don't know if folks saw, but the county put out a press release about the county's efforts to look at low barrier sheltering. So there's been some concerted conversation around that. Now the legislature has, given some initial support, and county administration is going to be working with DSS and others to try to look at sheltering. Not obviously, this is more about housing and moving people out of sheltering, but we also have a sheltering problem.
Yeah.
Related to that we are definitely working on.
As the county looks at solutions, there's two issues. One, cost to build something or purchase something or renovate something. And then there's the cost after the fact of maintaining it. And that's probably the biggest challenge, is the cost after finding a physical solution. Is the cost afterward, how you manage that, how you get reimbursement from the state or whoever.
Other thoughts? Thinking this is huge, it's just, it's wonderful that there's just so many people that are involved, but it's just a huge issue.
I do know that OMH really is looking to invest more in homelessness concerns. So I think it's really encouraging that our county was able to get some of that funding. That's really great.
I'm just curious, and I'm just, the movement of migrants from, let's say, Texas to New York City and beyond, is that going to be part of this?
Sort of sanctuary city.
Yeah. Are you looking at housing those folks as well, or is that something completely different?
It's, I mean, the individuals that, we're gonna be looking at the houses, they're gonna have to have a mental health diagnosis. So to me, I mean, there's nothing to say you know, who that has to be. It's just somebody, anybody who needs the help and they have mental health concerns and that, then we can help support an individual then in housing.
Yeah, with Renee's program, with this, with the SOS, I think if they're homeless, it wouldn't matter if they were a migrant that had come from the city or someone that was a resident of Tompkins already. If someone referred them to us, then we would just work with them, just like anybody else. They're barriers. Right.
For for the program that I'm running to, it's not just a mental health diagnosis, excuse me on that. It's also domestic violence or substance abuse.
Question for Frank, maybe. So when I think about the pathways in and like getting connected to the ACT team, I know it typically is routed in through like SPOE applications. I filled out my first SPOE application last week, which was much more cumbersome than the child SPOA application, which is nice and friendly. It makes it easier to connect people with services. Is the SPOE form decided at the state level, or as a county, do we have any decision making?
Is it Hancock or Handcock?
Hancock.
Oh, sorry.
I don't know. And I don't know the answer. I believe that it's driven by the state, but I don't know that for certain. I can certainly find out. Generally, we try to streamline everywhere that we can to make those processes simpler. So I want to think that if it is, if you're finding it cumbersome, it is state driven, but I will find that out.
I know that the children's one, they just updated in 2023 and it looked better, but the adult one is much more time consuming.
Yeah. I can check.
Thank you.
It's, I don't see a lot of it on the news where the southern border cities takes buses of people and brings them to sanctuary cities. I think there's 300 of them though. So I haven't heard, I guess, question that Ithaca has had any of that transportation was from the south to date. Has that not happened?
Are you asking, have any of the migrants from the border ended up in Tompkins County? Not in large numbers. If any are here, it would be one-offs. We haven't seen a bus show up, for example. The county did, when there was the first conversations about New York City busing people upstate, the county did, I believe, alert the state that we could take 50 people and be able to manage that. So, they're putting, our services behind our sanctuary city county status, that there is a number of people that we would be able to serve. But as far as I'm aware of, there hasn't been a bus that's been delivered here.
Okay, that's.
But it's New York City.
Not yet. Yeah, it's probably just a matter of time.
Yeah.
I'm aware of two migrant families that came.
Yeah.
One is renting an apartment in Newfield. It was a mother and two children. So it's not unusual.
Yeah, and we've been, our county, Catholic Charities and others, with refugees are part of our community fabric too, right? There are a lot of refugees that have come, not necessarily asylum seekers, but refugees. So I think we have a track record and history of, being open to, all people that are interested in being here. I think that the challenge is, do you have the resources that they come in large numbers? Trying to address that. So that was the county's approach with the state on how many we felt we could reasonably accommodate.
They anecdotally have a neighbor who's part of a church group that brings in refugees, but it's the housing portion is taken care of by people in the church. And switch that around. And as far as numbers, I heard 120. Was that county? Because I remember last year, one of the assemblymen said it was 60 in the city that were homeless.
That was it.
The number I was referencing was people currently sheltered.
So,
And again, please don't quote me on that number. It was just a rough number. Yes, and that number fluctuates from day to day and weather to weather. And the county is making some efforts to change their approach to sheltering, which probably likely had some impact on numbers, particularly when the weather wasn't as severe. Around congregate sheltering versus hotel rooms and such. So there's a lot of change going on in the system right now, trying to address what is a bigger number than we currently have capacity to handle.
coming back from Los Angeles, it seems, I think the numbers are 60,000 people homeless, but I think we're doing a much better job here.
Any other comments or questions?
Just want to say thank you to all these, to
Yeah.
all of you for doing some very, very important work.
Yeah, definitely. Thank you for coming and explaining as much as you could at this point to us. And we look forward to hearing from you again.
Thank you for having us.
Yes, thank you very much.
Have a good night.
Have a good
Thank
night.
you.
Bye.
You do have a quorum now.
Say you can, but if you prefer to take off.
Yeah.
Take you.
Great. Thanks for coming.
But anytime you want me to come back, just let me know.
Thank
Thanks,
you.
Tim. You do have a quorum now.
Okay, so we can go back and approve the minutes from December 2023. Oops. Taking a look at that. Right, do I have a motion to approve those minutes? Travis and second Sheila. All in favor? Oh, I forgot to ask, is there any discussion? No? Okay, great. Then they're approved. And let's see what else needed to.
Slate.
Oh, yeah. So we have the slate of the office nominations, officer
nomination.
nominations. Is there anyone here that wants to nominate someone or nominate themselves and whatever? We'll put that out there.
Nice.
That's what I get. Yeah. Diane is like, we're looking right. I don't even remember. Okay, so it looks like it's myself as president or chair and Sheila as vice chair.
You didn't need a vote.
Yeah.
So you need a
Okay,
motion.
so for both, because it's the slate, right?
Yeah.
Okay, so motion to approve Jessica and Travis.
Travis, that hand went up pretty quickly.
Yeah, everybody's supporting. I had so much faith in you. I appreciate you both so much.
Okay, so then anybody who can vote, all in favor?
We vote for ourselves.
Yeah. Yeah.
I'll vote for you.
Okay, I vote.
Okay, I think we're set on that. And then Mary had one quick thing from the nominating committee. It won't require executive session.
Yeah, just today we got an application for a reappointment for a member of the Substance Use Subcommittee. He's been on the subcommittee for some time, Ron Shoneman, and his term expired and he would like to be reappointed. So I don't know if you want to add anything, Stu, you're on that.
Well, Ron has been a member of the board for 25 years. He's a backbone attendance of the committee, which reminds me, looking to have a little bit more attendance from this board onto that subcommittee. But I wholly endorse Ron.
Okay, so we have to vote on that?
Yeah, you need a motion.
Yeah, okay, so a motion for Ron to be reappointed. Jessica, a second. Travis.
I'm sure.
Okay, all in favor?
Absolutely.
Excellent. So Ron is reappointed.
Mary, said that mean all the subcommittees are police?
No, we still have openings on substance use subcommittee and I believe one on developmental disabilities. So.
Point of
But all-
order. Well, I have a question. Has Ron been approved by the legislature for reappointment? Because they do the reappointment, we don't do the reappointment.
No, this was a recommendation for reappointment.
Yeah,
Yeah.
I just misspoke.
Okay.
It now goes to the legislature and
Yes.
hopefully.
And-
it doesn't get so
and just-
tough someday. That's what dear.
And just-
You said a fool. Will they get the contract first or what?
And just so you know, I actually was reappointed to both the Community Services Board and the Mental Health Subcommittee, so they do occasionally do what they're supposed to do.
Congratulations, Larry.
Yeah.
Welcome back.
You know,
Just by way of updates on my report, we've covered most all of it throughout.
Right.
The RFP for this opioid settlement funds is with county finance and admin. So it takes them about a month to do all of their reviews, legal. So we're hoping by the end of January that will be out. We're also hoping that our new friends from RSS and perhaps Catholic Charities might be interested. Because we do think there's a lot of, it might just be an expansion really of what they're going to be doing with this grant as well. So we'll see how that kind of plays out. We are working on the RFP for the outreach workers. We did meet with the city and the Downtown Ithaca Alliance with county admin, and they were in agreement that we should bring it all together. So Ross, who's did our fellow that did the RFP for the settlement funds, is working on the RFP now for that. So we're hoping that we'll be looking to review that towards the end of this month with the city and DIA, and then it'll start its processes with the county to get posted. But I think that's a real positive development in bringing that program together. I will tell you the families and children had said they weren't interested in continuing. So that also helped facilitate because we weren't taking the program from anyone to allow us to kind of bring it all together. So again, perhaps some of our new friends might be interested in something like that because they do that work in other places. So those two RFPs are in the work. I mentioned the press release that the county working on kind of low barrier sheltering and looking at that sheltering component of things. Maybe perhaps that was it. And then after the meeting is concluded, anyone that would like a tour of the new space, we're happy to take folks through and show you what we got going on.
Yeah, it's great. I got a private tour.
Updates on getting folks approved for the board?
Yeah, so I was actually at the ledge meeting last time when their names didn't get mentioned. So we have talked with the clerk's office. I emailed immediately during the meeting saying what's going on. Have you talked to
I
them?
think that's
since?
what's to Brittany today. She guarantees me the 17th and you will be official February the 6th.
That'll be the next, so they have to go to HHS in January, and then they'll go to the full legislature on February 6th. So
You on them.
we're doing our best. Randy's our liaison, so we'll have him, make sure that happens. Sure.
Along with the outreach workers, there's also a number of different care manager entities. I know that within the Tompkins County Whole Health, there's been an effort to help everyone understand what everyone else does. So between like the pitch outreach worker or
Community health workers.
community health workers, versus the non-pitch folks, is there going to be collaboration also with those folks and with like the SPOA folks?
Yeah, I mean, I think generally the idea is to kind of bring all of that together. There's been, I don't even know how to say this out loud, but the state has so much money that they've just been, that's why the contracts are so slow to get out, because there's thousands of them, maybe tens of thousands, because they've got all of the COVID money that they're trying to get out there. And so I think what we're trying to get our head around is how all of these programs are working together and then connect them with all of the existing things that we already have. What I will say is I think there is good collaboration amongst the outreach workers in our community amongst themselves. I don't necessarily know that the rest of us know what they're doing. Right. And so I think that's where it's incumbent on us to kind of figure that out and get that from them. Like I said, we've never had outreach workers. The community health workers were kind of our first foray into that, but they're doing a little bit different. I mean, the pitch program, for folks that don't know, we have community health workers out of this building that are doing work with maternal and child health services. So they're helping pregnant moms and families kind of navigate the pregnancy and such. And it's coupled with our maternal and child health programming. But we also have community health workers that the county supports that are doing non-pitch, which is, there's very specific criteria. You have to be of childbearing age, I think, is what the criteria is for pitch roughly. And then we have community health workers that are kind of looking beyond that. And so our folks are looking towards health, but we're also hoping that what we're trying to do is get us into the community so people know who we are and what we do, and then also bring back lived experience and understanding of need from communities that we might traditionally not have heard from or reached. So it's a little bit different than your traditional outreach worker, which is going out and trying to help the individual that they find out there. We're also trying to go out and bring that information back to the department with the community health workers. So it's a little bit different, but still along the same lines. This new outreach worker team is more traditional outreach worker, where they're going to be out in the field, going out looking for the individual and, trying to get them connected to the different services. I think by having it's going to be a contractual relationship, because we're not going to provide the services directly, but we will be more directly connected to how those services are being provided, which I'm hoping by having people kind of in the system, we're going to be able to get that real-time feedback on how the system is working, where the connections are, where they might be missed. And in our RFP, there's going to be a requirement that they work very closely with the care team, right? So the idea being that we're connecting those loops where we control those loops as much as possible. I think there's a lot of great work going on out there. People are working tirelessly, but I do think there are moments of duplication, and there certainly are moments of unclarity about, who's connected to who and who might be the best person to connect those folks to. And to a degree, we'd like to get to a no wrong door approach, right? So it shouldn't matter what outreach worker you're connecting with, we can get you connected to the appropriate services. So I think that's part of the goal moving forward as well, right? As we enter into this world of outreach worker. It's new for us. Housing and getting directly related to housing is not, it really hasn't been a task of either department when they were separate, prior to now. So we're trying to figure this out, because we do recognize that mental health diagnoses and substance use disorder diagnoses are a big part of the homelessness crisis. And so we do have a role to play there. And I think we're jumping in now and trying to figure out what that role should be.
If I could just put a little plug in, I'm actually working with Shannon Alvord at Tompkins County Whole Health, and we're helping to launch we're still on the name right now. It's a Frontline Human Service Worker Peer Support Group, and it's going to be looking at it came out of a request from a CHW at Tompkins County Whole Health and a community health advocate at HSC who wanted to create a space for all these workers to kind of come together and be amongst their professionals and support one another, but also I think have a better understanding of what everyone does. So we actually just scheduled the launch for that on February 29th. So myself and Shannon will be reaching out to about, I think, at least 15 organizations about inviting their outreach workers, their case managers, their CHWs, community health advocates to join this group. That's good as well.
I think this issue is front and center with the legislature. more so this coming year probably than past years, you would say. It all comes down to, of course, it's your tax money, how it's going to be spent. But I think the legislature has figured out that they need to do something, and they can afford to do something with your money. And so I would speak to your legislators, and so because there's a lot of ideas floating out there, a lot of good ones. And it's going to impact the community positively. But no matter what you do, somebody's not going to be happy about it. So I would share your thoughts or listen intently over the next few months. I think a lot of issues will come forward, as to how the county is going to, try to put a dent in this problem. So.
Great, thank you. Larry?
I have a quick question, Frank. When does the contract with Family and Children's expire, or is it done? Are they done now, or are they still doing outreach work in the city?
I'm sorry, I do not know the answer to that question. If it was still 2023, I'd say, oh, probably at the end of 2023, but now it's 2024, so I can't say that and not be wrong. So I don't know the answer to that, Larry, but I will find out. I know they had lost staffing, so it was difficult for them to manage. I don't know if I don't know the answer to that, but I can certainly check into it.
Great. And the other, just a quick suggestion. When we know how the care team stuff is going to work in the city and as it's working in the county, I think it would be just as important to put out a press release about how that's going to work and how it's working, in the same vein as what the county just did with the homelessness stuff, because I think there are people in the community who think that or believe that the county doesn't do anything when people are in crisis. And I think we need to nip that idea in the bud. So as soon as we're clear about what the person will be doing with the city, I think we want to publicize all the work that the county and the city do to respond to people in crisis.
Great. Anybody else have any comments or questions for Frank? Okay, then, is there anything else you wanted to say?
Well, Elena's here. She has to introduce herself. She's put an application in to be on the CSP.
We met
Great.
last.
Yeah.
I will introduce myself again. So I'm Dr. Elena Zaff, and so I currently work at Guthrie. I am a integrated primary care psychologist. So what I kind of do is I get all my referrals from the primary care, either family medicine or internal medicine department. They all send their referrals to me. I have a brief short-term model of therapy. And then my goal is to hopefully have that be sufficient or get them to where they need to go for long-term support. So that's kind of what I do. I previously finished my postdoc at Cornell. I'm in the process of getting ready to sit for licensure. And so that's kind of the updates. But otherwise, I think, being new here, my interest is one, being kind of the first mental health provider at Guthrie. I really want to make sure I'm very well integrated and aware of the services and very a part of it. I want to be able to participate in this whole process and try to make sure that I'm doing my due diligence too, to have all the information, but also bring ideas and thoughts as a newer face to this location. So thanks for having me.
Okay, do I have a motion to adjourn?
Motion to adjourn.
Motion. Oh, some people just adjourn and the chair adjourns.
I know, that I was.
Yes, as the chair, you can probably decide. And you just adjourn the meeting.
We just adjourned the meeting.
And you need a gavel. I just feel like,
Judge Judy. Right, you're leading the call.
Yeah, yeah.